Hi everyone, Dr. Bruce here. This week's short topic video is a bit of a review of anatomical terminology. What I'm using is a 3D anatomical model that I produced and I'm hosting on Sketchfab. I can also give you the link to my model page. There's over 100 anatomical models. I think these are helpful in that they can be used to help you study. You can quiz yourself. You can try to, name the part before clicking on the annotation. They're all annotated. Another reason that I'm doing this particular video is that it's difficult sometimes to pronounce the anatomical terms. So of course I'll pronounce all of these terms and you get to hear the correct pronunciation. So always good for practice. So I'm going to click on each one of these. You can see the annotation, then I'll read off the terms. So this area is of course the frontal area. It's the forehead, the frontal area. The area around the eye is called the ocular or orbital area. The area around the nose is the nasal area. This, of course, is the oral or mouth area, and the chin is the mental area. Then we have the buccal or cheek, and on the side, the otic or ear. And then the entire head is called the cranium or cranial area, also known as the cephalon. That's another name for the head. Here we have the neck, which is the cervical area. And then moving down into the shoulder, we have the acromial or acromion. This is the highest point of the shoulder, but in anatomical terminology, it also denotes the entire shoulder. Then we have the thoracic or pectoral area. The thorax or thoracic area is a bit confusing because it refers to both the front and the back. So you can have the thoracic area in the back like the thoracic spine, and you can have it in the front, the thorax or thoracic area in the front. In the middle of the chest, we have the sternal area. This is where the sternum, the bone called the sternum, is located. And then moving down to the arm, we have the brachium or brachial area. And then let's just reposition this a little bit, pull this up. The elbow is called the antecubital area. That's the anterior portion of the elbow. And then the forearm, this one is called the antebrachium or antebrachial area. Let's rotate the model around to the back and look at some of the structures in the back. This structure here is near the bone called the occipital bone, so it's the occipital area. That's the back of the head. And then here we have the scapular area, which is just lateral to the midline. That's the posterior portion of the shoulder. Here we have the dorsum or dorsal area, and then it could also be called the thoracic area in the back as well. Let's reposition a little bit. And let's go to the olecranon area. That's the posterior elbow. Okay, so I'm going to try to set up the other model very quickly here and pull it over. Let's do that. Let's pull this one over. And once it loads, we can go ahead, go full screen, and do the rest of these. Okay. So here we have the abdomen or abdominal area, which of course is the stomach. In the middle, the lower middle portion, we have the umbilicus or umbilical area. Down here we have the pelvic area. That refers to the entire portion below the abdominal area. Here we have the pubic area right in the middle, and the perineal area, which is underneath. So let's get this reoriented. To the side, we have the groin area called the inguinal area or inguina. And then in the leg, we have the femoral. That's the upper portion of the leg. The knee is the patellar area in the front of the knee. On the lower lateral aspect of the leg, we have the fibular or perineal area. In the front, we have the crus or crural area. On the inside of the ankle, we have the tarsal area. And then the foot is called the pedal area. So let's go back up and look at some of these other structures. The hand is called the manual area. And then also the fingers are called digits or digital area, and the pollex is the thumb. That's what this says right here. Let's rotate around to the back and let's see what else. We have the thoracic area, like I said before, or thorax, refers to the front and the back. And of course the gluteal area. Behind the knee we have the popliteal area. Oh, I see, it's not marked popliteal, it's the front. But it would be the popliteal area. This is called the sura or sural area. And that, of course, is tarsal. And I think I have the heel done marked. That's the calcaneus or calcaneal area. Okay, so hopefully this helps you with reviewing anatomical terminology. This, of course, will be on the exam. So you'll want to use, if you want to use these models, I'll post a link in this announcement. You can pull up these models and just practice learning the anatomical terms. All right, thanks for watching and see you next time.